Hey! Welcome to DHVit Animations. Today we will discuss Infectious Keratoconjunctivitis, which is also called Pinkeye, infectious ophthalmia. First of all, we'll discuss the introduction. Infectious keratoconjunctivitis of cattle, sheep, and goats is characterized by blepharospasm, conjunctivitis, lacrimation, and varying degrees of corneal opacity and ulceration. And the causative agent is Moraxella bovis. Now, we are going to show you some pictures of this disease. We will discuss further in this disease are as follows: clinical signs, lesions, diagnosis, prevention, and treatment. Now, we will discuss the clinical signs of this disease. Clinical signs. Number 1, one or both eyes may be affected. Number 2, in cattle, dry, dusty environmental conditions, shipping stress, bright sunlight, and irritants such as pollens, grasses, and flies tend to predispose to and exacerbate the disease. Number 3, flies also serve as vectors. Clinical signs. Continues. Number 4, the initial signs are photophobia, blepharospasm, and excessive lacrimation. Later, the ocular discharge may become mucopurulent. Number 5, conjunctivitis, with or without varying degrees of keratitis, is always present. In goats, mammary gland and uterine infection may also occur simultaneously with keratoconjunctivitis. Now, we will discuss the lesions. Number 1, lesions vary in severity. Number 2, in cattle, one or more small ulcers occur near the center of the cornea, which are often preceded by cloudiness of the central cornea. Number 3, initially, the cornea is clear around the lesion, but within a few hours a faint haze appears that subsequently becomes more dense. Number 4, about 1 week after the lesion first appears, blood vessels begin to invade the cornea from the limbus toward the ulcer. Now, we will discuss the diagnosis. Diagnosis. Number 1, in all species, presumptive diagnosis is based on ocular signs and concurrent systemic disease. Number 2, it is important to distinguish that the lesions are not due to foreign bodies or parasites. Number 3, in IBR, upper respiratory signs and conjunctivitis predominate, while keratitis accompanied by ulceration is rare. Last step is prevention and treatment. Prevention. First step, separation of infected animals from normal animals is beneficial. Second step, ultraviolet radiation from sunlight may enhance disease, particularly in cattle. Treatment. First step, oxytetracycline. Second step, effective antibiotics for topical use is the combination of oxytetracycline and polymyx and B ointment. Subscribe our channel, DHVit Animations, for more